Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Beta blockers. The beta blockers actually belong to the class 3 it belongs to class 3 anti-arrhythmic drugs. These the beta blockers which has membrane stabilizing activity are the beta blockers which are used in arrhythmias. They will reduce the influence of catecholamines in the heart. By inhibiting the beta blockers, the catecholamines like adrenaline, noradrenaline, which are normally present in the body, they cannot act on the beta receptors of the heart. So they can be used in as drug of choice for some types of arrhythmias, like they are the drug of choice for exercise induced arrhythmias. So beta blockers are used as drug of choice for exercise induced arrhythmias. They can also be used as drug of choice for arrhythmias which are mainly due to pheochromocytoma, or they can be used as drug of choice for arrhythmias which are mainly due to the thyrotoxicosis induced arrhythmias. And there might be some arrhythmias, especially we can use beta blockers in atrial fibrillation. They can be used in beta blockers in atrial fibrillation, mainly to control the ventricular rate. We can use the beta blockers. Beta blockers can also be used during the MI to prevent arrhythmias. Also, we can use the beta blockers. Beta blockers are also the drug of choice for idiopathic ventricular tachycardia, or they are also the drug of choice for ventricular premature beats.
thank you and thank you for watching.